I had to step outside into the ambulance bay after codes just to get that N95 off and catch my breath, right? Because we were just, intubating, code, who's gonna need the next ventilator.
People struggling, people alone, people dying.
It felt almost like the end of the world, to be honest, or like a war scene in a movie.
On my way out of the house to the ambulance, I have a daughter, my son, my wife. I wanted to have a eye-to-eye contact individually with each and every one of them because I wasn't sure if they would ever see me again.
It's really hard to think back and describe those moments.
Nobody is the same person they were pre-COVID.
I really don't think the images that we see in the news do justice to what patients, their families, and the people trying to get them better and get them home have seen and gone through.
They don't get to see that the staff goes to another floor to change their clothes before they walk onto their unit. They don't get to see the staff double gowning up or double masking up to walk onto their unit.
People are we're sleeping in their cars, taking everything off as soon as you get home in the garage and jumping right into the shower, sleeping in different beds from their spouses and loved ones.
I worked 100 days without taking a day off, and many of those days were 20-hour days.
This is the closest to combat that we've ever seen in a civilian setting.
For this entire year, our doctors, our nurses, all of our healthcare workers ran into the fire. They've signed up for shift after shift.
We're burnt out.
The biggest lesson learned here is that this investment in public health and public healthcare systems set us up for this tragedy.
It really shined a light on the thin margins in which healthcare has to function in order to care for the most vulnerable in our community.
There's a lot of rebuilding that needs to be done. Healthcare is in the middle of that.
We've got to get people back in care. This would be a horrible time to cut funding.
Our populations were hit so hard because of healthcare disparities. And I think if we allow these cuts to happen, we will have not learned that valuable lesson.
We're still in this. Like our life is COVID. It's COVID from morning to night. And you don't thank people for doing that by taking their budget away and taking their finances away for caring for people.